Okay, good morning. Today is Saturday. So before we start, let me do some sound check. Check, check, check. Sound check. And hopefully we are all connected with the sound check. Yes, perfect. Good morning again. So today is Saturday, September 23rd, 2023. This is our regular Saturday morning class. And as you know, we've been doing it in person for a long time. Now we are doing it virtual after the pandemic. And actually, the beginning of the year, we are started doing it. The requests. So today is the request is cardiac diseases, primarily the heart disease, yoga therapy for cardiac diseases. As I said, you can please send your request for the common diseases, which will do it. We really have done this program at the beginning of this year, which was a part of called yoga therapy for metabolic syndrome. Now let's talk about first, like every other time, the pathophysiology, pathology and physiology of the disease. And as you said, once you understand the concept, you will be able to pick and choose from your own practice and use it for cardiac diseases. So what are the cardiac diseases? The first one, we call it the common term is a heart disease, heart attack, myocardial infarction. It is basically the blockage in the arteries called coronary arteries, which supply blood to the muscles of the heart called myocardium. When the vessels get blocked with, we call it a common term is the hardening of the arteries, the medical term is the atherosclerosis, and you started having reduction in the blood supply. But our divine has done a superior job. So when the blood vessel starts to slowly narrow down, it develops some extra blood vessels around, which are called collaterals. So for all practical purposes, which is a misnomer, that the blockage in the artery do not cause a sudden heart attack or sudden myocardial infarction. What you call about acute heart attack or sudden heart attack is called the unstable plaque and the rupture of a plaque. So think about it. This is an artery. There are three main arteries in the heart. One is called a right coronary artery, in the middle called a left anterior descending called LAD in the left, and that is the two big branches. This artery has now 30-40% blockage. And by the theory of physics, the flow doesn't reduce unless you get a 75% reduction of the surface of that lumen. But this plaque, this is a hardened, calcified cholesterol plaque. This plaque will rupture in sudden change in the hemodynamics. That means sudden change in the blood pressure, sudden change in the heart rate, and sudden change in what is called also the emotional stress. It's like your volcano. Volcano is erupting. So now it is 30-40% blockage, which has no reduction in the blood flow, gets complete block, 100% block. And it has a total shutdown of the blood supply to the muscles of the heart, which is called myocardium, and it has not developed the small vessels called collaterals, which it will develop when it slowly became more and more narrowing. Like 90% blockage, you will get a plenty of narrowing, and generally it's not going to give you an acute heart attack or acute myocardial infarction. So able to control your sympathetic overdrive, able to control your sudden change in the blood pressure and heart rate, or sudden change in emotion through a daily practice of yoga, eliciting relaxation response and parasympathetic activation, you will be able to protect and prevent an acute myocardial infarction, heart attack. When the heart muscle starts to get damaged through a work for a lot of time or through a underlying, we call it a small, mild myocardial infarction, muscle doesn't function, then we get a situation called a heart failure. That means heart is like a pump, it cannot pump properly. So you get a backup, and backup, the fluid builds up into the lung. So you get a shortness of breath in exertion. Like you walk, you get a shortness of breath, or you're climbing up to the ladder, you get a shortness of breath. That is a sign of heart failure. Then there is a condition called the valve disease. We have two main valves, aortic valve and a mitral valve. The valve gets narrowed, called stenosis, or valve gets incompetent. So the aortic stenosis or aortic incompetence, same as a mitral stenosis or mitral incompetence. Then you have other valves called even pulmonary, called tricuspid valves. Then also the cardiac disease involves all the peripheral blood vessels. So blockage in the blood vessel in the neck called carotid arteries will lead you to stroke. Blockage in the blood vessel in your legs, called a PAD, peripheral arterial disease. Blockage in the arteries in kidneys will cause renovascular hypertension. So it is the same gamut of your atherosclerotic disease. Then they have a congenital heart diseases. The kids are born with it, and okay, when it comes up, I'll let you know. So the older concept is the heart disease has a risk factor. High cholesterol is a risk factor, diabetes is a risk factor, high blood pressure, hypertension is a risk factor, truncal obesity, omentum here is a risk factor. But today, the concept has changed. There is no risk factors. These are all under one umbrella of disease called a metabolic syndrome. And what is the cause of metabolic syndrome and how yoga therapy can help the metabolic syndrome. If you're interested, you can go back. I don't know exactly which month, maybe at the beginning of the year, February or March, you did 2 sessions, yoga therapy for metabolic syndrome. We have seen a lot of people with developing a heart attack with called essentially we call no risk factors. Blood sugar is normal, blood pressure is normal, cholesterol is normal. They don't have even truncal obesity. So what is the cause? The cause today, we call it a hypersympathetic tone. That means our sympathetic overdrive, which is called fight and flight response. Our fight and flight response is creating our heart conditions or heart attacks. And the most important of this fight and flight response is our insomnia and sleep apnea. Sleep apnea is connected to every known disease you can think about: diabetes, hypertension, heart disease. nocturia. But sleep apnea basically is a fear. And you stop breathing. But when you measure the oxygenation, and oxygenation is not there, but it's a sense of fear which triggers. The fright and flight response is also a fear. What it triggers? It triggers your emotional part of the brain, which is called the limbic system. Activates the limbic system. There are two nuclei called amygdala and hippocampus. Amygdala responds to fear, hippocampus responds to memory. It sends a signal through neurotransmitters to hypothalamus for homeostasis. That means to correct. So if you have a fright and flight response, which is sympathetic, it will start generating, called a calm and digest, which is called parasympathetic, which will come from a practice of yoga. But when you are not calm, this activation of hypothalamus then sends a signal to the pituitary adrenal axis, pituitary gland, adrenal gland, and it secretes a hormone called cortisol. Cortisol is a hormone of stress. Hypothalamus also sends a signal to your autonomic nervous system, sends a more signal to your epinephrine, norepinephrine, and sympathetic overdrive, and disproportionate sympathetic overdrive, then parasympathetic tone. Cortisol is the root cause of our truncal obesity. Cortisol converts the sugar, which is the end product of metabolism, into a fat, which is called omental fat. And the omental fat is not under the skin, it is inside the abdomen. You see, when it is like an apron coming up from your called a transverse colon all the way covering the abdomen. This omental fat gives you what is called a truncal obesity. We call it expanding waistline, spare tire. We have a lot of nickname for it. This truncal obesity, this omental fat is like almost like an endocrine organ. It secretes pro-inflammatory molecule, it secretes adiponectin, and this is the pro-inflammation. The inflammation is the underlying cause. Inflammation starts causing diabetes, hypertension, we call it dyslipidemia, abnormal lipids. What is the abnormal lipid which causes heart disease? Obviously we call it high cholesterol, then high LDL, called low density lipoprotein, which are the bad cholesterol, low HDL, high density lipoprotein, HDL. HDL is your protective cholesterol, so when it goes low down, it causes your heart disease. And also nowadays there are triglycerides. So you have a high triglyceride, low HDL. That is the classic features of underlying coronary artery disease. So the whole feature of the gamut is called metabolic syndrome. Today I have a diabetes, tomorrow I have a heart disease or coronary artery disease. Today I have a coronary artery disease, tomorrow we'll have a diabetes. Today I have a high cholesterol, tomorrow I will have. So it is not the risk factors anymore. So therapy will like to relaxation response, parasympathetic activation, and bringing calming, quietness in the body and mind. Chitta vritti neuron. Chitta is your mind. Vritti is a chattering. Control the chattering of your mind is a therapy for cardiac disease. So what are the things we do? A relaxation practice, relaxation of your hands, relaxation of your wrist, relaxation of your chest, relaxation of the muscles, relaxation of your neck, Relaxation, your whole body and mind, which you have all done. Remember, we do a daily practice, and our daily practice covers almost every known disease you have. So when you have underlying disease, you have a pick and choose. So yoga therapy is an adaptation of the yoga practice based on your clinical condition. So, give you an example. If you go to the website, say if you go to, I'm not saying about, WebMD or anything, I'm saying about going to the PubMed. Look at the research papers. A back bend improves your cardiac function. Side bend, side stretching improves your cardiopulmonary function. And also remember, in yoga, heart and lung is the same organ. If you put a stress in your heart, you'll get an effort in breathing, and you get an effort in breathing, you will get an effort in heart. Your heart rate will go higher, blood pressure will go higher. But most important in relaxation response happens when your breathing becomes effortless. Remember, dis-ease. Therapy for dis-ease is effortless ease. Your ease is all effortless. So you get a better return of the blood. It's called the better venous return to the blood, which is, most of the medical people understand, is called a preload. Increasing the preload of the heart from yoga practice, and that the relaxation response will reduce your peripheral resistance. So reduction of the peripheral resistance will cause the reduction of the afterload. That means heart is pumping very easily. Pump does not have the resistance to pump. So increase in the preload and reduction in the afterload improves your ejection fraction, which is function of your heart. So yoga therapy, number one, is a protector. Yoga therapy number two is your cardiovascular maintenance. If you put your head below your heart, inversion, semi-inversion poses, pressure in the brain goes higher, pressure in the eye goes higher, pressure in the carotid arteries goes higher. But if you keep your head down slowly and slowly, you develop what is called a neuroplasticity, the habit forming. Pressure in the brain comes down, pressure in the eye comes down, pressure in the heart comes down, with a phenomena called baroreceptor sensitivity. When baroreceptor sensitivity goes high up, it acts like your beta blocker, the medication you take all the time. So, a protection against a sudden rise in the heart rate, sudden rise in the blood pressure will not happen when you have a baroreceptor sensitivity. Same as a chemoreceptors, pranayama. So we do, as I said, 25 minutes of asanas, 25 minutes of pranayama, and 10 minutes of meditation. Yes, we see people who have a physical, got a sudden heart attack because of rupture of the plaque. Oh, I'm playing tennis, I'm running, I'm weight training, they put doing a hard weight training. Suddenly got a chest pain, got a heart attack. Person will come and say, I haven't done anything. I got a heart attack. Yes, you have not done anything, you have been screaming and yelling to your friends or your families or a spouse or your children. So that emotional stress to us today is more than your physical stress. Pranayama breath is the most important for your relaxation response and activation of parasympathetic tone. You need to activate your vagus nerve. Vagus nerve is a mediator of your parasympathetic tone, stimulation of the carotid sinuses, which is mediation through your cardiovascular system and nervous system. So, what are the practices we talk about? So, our regular practice. What is a regular practice? Keep your spine straight and do a relaxation response practices. Here I am sitting on my kneeling stool. The spine is straight. Mind is the content of your five senses. I hear, I see, I smell and taste and touch. I close my eyes. Hand is the connector between body and mind. I touch my index finger and thumb. Eyes are closed. Pay attention to my breath. Lung is like a balloon. It has 6 liter capacity. It needs 1.5 liter to keep it open. I have a 4.5 liter air which I can exchange, but normal tidal volume, that means amount of air we breathe in and out, is only half a liter, 500 cc. So learn how to breathe out first. Slowly breathe in without any effort, but as long as you can. Breathe out longer than breathing in. Keep doing it. If you want to count, you can count. Count of 2 in, count of 4 out. Slowly and slowly you will get used to, because muscles of respirations are skeletal muscles. Keep practicing. Like for us, we can go 6 seconds in, 12 seconds out, 8 seconds in, 16 seconds out. So let me show it to you how we have achieved this part. I'll be doing in silence. I'll breathe out first. I'll breathe in with a count of 8 in, that means 8 seconds in. I will breathe out with a count of 16 seconds out. So did 8 seconds in, 16 seconds out, completely effortless, improving my pulmonary function, cardiac function. Money back guarantee. This is going to keep your cardiac function. Why? Heart and lung is the same organ. Look at this scenario, person who is dying, we call expired. Last breath comes out. When the last breath comes out, lung stops. Lung stops, your heart stops. Heart stops, your brain stops. Brain stops, your cellular function stops. So improve your breathing, you improve your cardiac function, improve your brain function, improve your cellular function, which includes the muscles of the heart called myocardium. A simple explanation is it. You don't need to be a rocket scientist to understand this. So as you know, we do all the hand. Hand is relaxed with a called Adhi Mudra, Balo Mushti Mudra. Put a thumb inside and close. So this will be doing the practices all the time. Even you can do the breathing. Breathe out first. Take a deep breath in. Breathe out and close. And this is the way the baby fist. This is also called a baby fist. Balo Mushti Mudra. Breathe in. Breathe out. But all yoga practice starts with the breathing out first. And the breath has to be effortless. There has to be no pain. And hand is relaxed. Your hand can go everywhere. You know, it's a fascinating. And then we also have this. This is your health tracker. I can watch all my heart rate, blood pressure, EKG, you name it, when I'm practicing. Chest relaxation. Prayer pose to the back. So put your hands to the back. And you do all the time, daily practice. Slowly turn your hand. Okay, so you can sit. So if you're here, you stay here. Stay here some time. You'll be able to put it as a prayer pose. Paschim Namaskar. You slowly stay here, you'll go high up. But you will be able to stay. Staying in asana is your yoga therapy. You like to say between initially when you practice between 5 to 10 breaths. But for us who've been doing it for some time, this is our normal posture. We incorporate this Paschim Namaskar with a lot of other cooling technique. One cooling technique is your improving the cardiac function. The Sanskrit name is called a Bakho Shital Asana. Bakho is the chest, Shital is the cooling, also is a pose. Chest cooling pose. It is the prayer pose to the back and slowly your back bend. So you close your eyes, keep your spine straight on your kneeling stool and slowly go back as much as possible and stay in this pose. And able to stay in the pose and able to talk, able to breathe, able to sing. Don't make any effort. Huffing, puffing effort is good for your building of strength and stamina. For healing, you need effortless ease. Bakho Shital Asana. Bhramri Pranayam. You've all seen to me doing it, bumblebee breathing. Shut down your 5 senses. You have a sound of a bumblebee when breathing out. Brain has a frequency, body has a frequency, and bumblebee sound has a frequency. These frequencies are almost identical. The frequency cancels, or harmonic resonance, and the whole, your mind and body quiets down. Health in Sanskrit is called a shastro. Sha-sthi. Sha means self. Sha means your soul. Sha means looking inside yourself. Sha means introspection. Sil means stillness. Stillness of your body, mind and spirit. Balancing of your body, mind and spirit. These are the signs of health. So here you are, the Paschim Namaskar. I'll breathe out first. Take a slow deep breath in and breathe out with the sound of a bumblebee. It's a wonderful, wonderful practice. Keep doing it. Heart disease will not come close to you. Neck is another tight part. Incorporate Brahma Mudra, the 4 postures of the neck, with your hands in the back, Paschim Namaskar, and breathing out to the sound of a bumblebee. Here is a practice. Breathe out first. Just slow deep breath in and drop your head to the back. Breathe out to the sound of a bumblebee and drop your head down. I hear it all the time. At neck surgery, I have screws, bold plates in my neck. My doctor asked me not to turn, not to move your neck. If you're not on a pain medication, do not do any yoga practice after taking pain medication. When you are doing any body posture, if you don't have any pain, and if your breathing is effortless, you are not going to be able to hurt your physical body and mind. Effortless ease in a practice. Side to side, on both right side and left side. Breathe out first. Deep breath in. Other side. shoulder. Slowly turn your neck left to the back to the right, and right to the back to the left. The same sound of a bumblebee. All calming and cooling practice. We have a person in our class, he was almost a cardiac cripple. So many cardiac events. Ejection fraction was 20%. He got better with yoga practices. What he had from his own introspection, looking inside him, he was practicing more of a balancing poses and hand mudras. Hasta mudra. Hand connects your body and mind. In the brain, half of your brain, the motor cortex, controls your hand. You will say something nice when you feel it. Before you can say it is nice. Or you can say this before you say give it to me. So hand mudra, this is your called dhanu mudra or gyanu mudra. This is quieting down your mind. But for cardiovascular disease, it is called a pitta related disorder. So according to Ayurveda, the vata pushes pitta. Like when the vata is out of control, pitta will be out of control. So when you get your index finger down and thumb in the top, this is a Vayu mudra. Very, very important for cardiac relaxation. Apna mudra or Pachan mudra or cleaning mudra. Body cleans everything. Remember, high cholesterol, high uric acid, high sugar, everything, it is your called ama, undigested food. Food is not properly digested, so it becomes a high sugar, high cholesterol, high everything high. So when you are in a Pachan mudra, it is all digesting. All the food is converting into your 7 tissues called Saptadhatu and the ojas. your blood chemistry becomes better. We have so many people having blood chemistry. With this mudra, apna mudra, put your index finger down. It's called the apna vayu mudra. And this is called your hriday mudra. This is for your heart. Improving your heart function. Touch your middle finger and thumb. Middle finger, ring finger and thumb. Then drop your index finger down. A hriday mudra. As a very famous yoga teacher, he was climbing, his flat was in 13th floor. He was climbing the steps every morning, 13th floor. He would do with a hriday mudra, cardiac mudra. Very gentle Bastrika pranayam, the bellows. Very gentle Kapalbhati pranayam. But most important is alternate nostril breathing. And then coming and cooling will be your Sitali pranayam, Sitkari pranayam and your Swadanta pranayam. I think I have my bellows. I'll find it out and I'll show it to you at the bellows. I'll show you these pranayamas, and also these are all in my pranayama practice, so you'll be able to see. So chest opening poses. Fish pose, Matsasana. Laying in the floor, chest opening poses will be your Matsasana. Many a time you'll be able to do it. You can put 2 pillows in the back and chest expansion. Bhujangasana, cobra pose. You get into a cobra pose, your chest is getting expanded. My chair, especially the chair I had for all of you. Always use it. So think about the asanas which will help you to quiet down and calm down your body and mind. Obviously, able to sit down. This is called your Sthiram Sukham Asana. Stillness, happiness asana pose. And you don't push yourself. There will be no pain. And breathing will be effortless. When you're comfortable, you change your leg. So activate both sides of your brain. Balance of your body, mind and spirit. Use the balancing poses with the mudras and also with the pranayama. You do not do pranayama standing up, but you can do it to see your balances. You can do a laying down poses, you can do a sitting pose, as usual, we do a standing poses, the poses. Able to keep your spine straight will bring a relaxation response and be comfortable for your heart condition. Able to get up without a support. Here it is, you're sitting down. From here, you get up simply without a support. This is your me show it to you. All the standing poses. So for all the people with a cardiac problem, let's start with the chair in front of you. I may not need, but I'm showing it to you so you can do. Start with the balancing poses. Or before that, start with the spine straight. Tadasana. Put your feet together. Touch the back of your ankle, screen, your hips, shoulder, and your head. Slowly get your hand high up. Close your eyes. Breathe out longer than breathing in. 5 to 10 breaths to daily morning. Wonderful practice first thing in the morning. We are lateralized. I'm right-handed, right-footed. So, I'm right-handed, right-footed, always using my left brain, I'm using my right brain. So, I'm comfortable standing like this, so put your feet together. Let's see if you can stand on your non-dominant leg, that is my left foot. I'm standing on my left foot. Initially you can put your hand here to be sure, and slowly let it go. From here, what you can do next, close your eyes to see if you can stand the non-dominant leg with the closing your eyes. Very difficult initially, but when you are able to do it, it is a sign of cardiac health. Able to get up without a support is a sign of your cardiac health. Balance it, opposite side, standing on your right foot. Close your eyes and just see if you can stand in the right foot. Wonderful practice. Get into tree pose, precaution. You get into the tree pose. You can do tree pose with the hands high up, tree pose with the hands down, but try a tree pose with Paschim Namaskar, hand to the back. You will have a different feeling and sensation. Precaution with Paschim Namaskar. You want to bring more relaxation, you can do some Kapalbhati Pranayama here. We really don't want you to do a pranayama practice standing up because pranayama causes an altered sense of consciousness. But this pranayama, the Kapalbhati pranayama, is your relaxation response. A Garudasana. You can take your one leg, take and wrap it around the other leg, and able to stay here. And if you do with your one chair is good, then you can do with your, you can do with your hands as a prayer pose. And also you will be able to do with your arm. Always do the other side. Now here, now we go to the other side, go to Rasan, wrap it around your leg, touching, generally we do without the chair support, but showing it to you that how to do it. With the chest, what it works better is your other part of the eagle pose, Gururasan, hands, wrap it around your hand. So my left hand is high up. Now if I see if I can stand on my right foot and my left arm is up, balancing both sides and crossing. This is what brings your balance and cardiac health. People always ask me, I have a heart attack, what should I do? Give me A, B, C, D, I'm puffing. No, it's normal effortless breathing. Start slowly. Everything will come to you. Right hand going high up. Now the right hand is going high up. So if I can stand on my left foot with the right hand going high up. Bastrika pranayama, bellows. Bellows is so the practicing, you really don't do it. I may have a bellows here. Let me see. A friend of mine gave it to me. So I don't know if you have seen this is a real bellows. Blow it. So inhalation, exhalation. See from the side, Or see from the back. You can see, and that's what it looks like from the back. I'll show it to you. Inhalation, exhalation. It is for your fireplace, it's for the goldsmith does it. This is what the bellows is. For your cardiac health, you incorporate this bellows with your very slow sit-ups. Wow, what a practice. Breathe out first. Take a deep breath in. Breathe out, slowly come. Get up again, breathe in. I did 20 counts. My heart rate is 135. or 133. If you can see it. 134. Can you see all of you? So, by simply able to do it, that is almost my 85 to 90% of my predictable heart rate for my cardiac stress test, which I have elicited effortlessly. Why effortlessly? I'm talking, I'm breathing. Slowly coming down. It's the effect of your cardiac conditioning. Take your time for the heart rate to come down slowly. So, we do the treadmill. When you treadmill, keep your heart rate 220 minus your age. That's your 100 percentile predictable heart rate. If you can cross your 80%, so it's come down to almost to the 100 now, still coming down. And able to sustain. Should be able in a treadmill, or if you're walking, you're slowly running, be sure there is no pain, the breath is effortless. Putting your head below your heart, activating your baroreceptor sensitivity. Prasarita Utthana Asana. Wide angle forward bend. Then with the Kapalbhati Pranayama. Absolutely important for your cardiac function maintenance. Slowly coming down, putting your head down. You see? Yes. Slowly my head will come down. I'll be doing a slow Kapalbhati Pranayama in this Prasarita Utthana Asana. We continue to keep on doing it until you get any little effort in breathing, but it will increase the baroreceptor sensitivity. Why? The intracranial pressure is down, intraocular pressure is down. I have an ophthalmologist, he came. He had a glaucoma. Increase in the pressure inside the eyes. He himself is a physician. He said, I don't want to put my head down. I said, it's fine. Wouldn't you try a little bit and do it effortlessly? Showed him to him. So most effortless practice is able to sit down in a Vajrasana. So if you're able to sit down in a Vajrasana, spine is straight, body gets relaxed. This is your stance. Put your stance here. Clasp your hand, put your head down. You feel miserable. You cannot talk. You cannot breathe. But you stay here. When you stay here for some time, what happens? Your flushing in your face will go away, watering in your eyes will go away, you will be able to breathe normally, able to talk. Get up, keep walking. When you keep walking, you'll see your feet is going to go high up. That will be the beginning of your headstand. Don't let anybody touch you. Don't let anybody throw you. Your feet is going to go high up on its own. You may have a little bit of a sense of fear, so I do it every single day. So you may do it. Let me see. Just do it against the triangular wall, okay? Here I am. I'm going high up. Slowly, I'm going high up. I'm still, I'm not touching anything. And I'll be up in my headstand. And I'm supporting myself, okay? That's good. I'm breathing normally. I'm talking. I don't have any effort in breathing and my whole body. What a wonderful practice. You're able to do it. You are in a calming, cooling. This is the most relaxing asanas ever we're doing. Slowly coming down. My face is not flushed. I still can talk, still can breathe, and I can check my vital functions now. Heart rate is around 98. It's good. Go back to my EKG. Let me do EKG here. Takes 30 seconds to do an EKG. perfect. Normal sinus rhythm. This EKG doesn't show any sign of atrial fibrillation. So, getting up without the support. It's a wonderful practice we've been doing. Now, gosh, the time flies, you cannot keep up. So, as I said, once you keep your back of your mind, say, all the back bends. You can name it all the back bends. Back bends on the mat. Makarasana, Cobra, Bhujangasana, Locust, Shalabhasana, Dhanurasana. Maybe one of the powerful, even side stretch, will be your, say, Trikonasana, triangle pose. So what you do, don't push yourself. Turn your right foot out. This will also work for your say, Virabhadrasana, okay, warrior. Put your hands, slowly bring it down, whenever it comes. Push it comes. Slowly get your hand high up. Keep on coming, and then push your body to the back against the wall. Will be your perfect Trikonasana. Measure your cardiac function. Ejection fraction is going to go high up. I love these asanas. Huh? Everybody says, oh, at your age you do all this stuff. I said, what my age? My age is up here. Your mental age. Same thing. If you come down here, stay here. Come down here, stay here. Put your hand high up. All the way high up. Put your body against. Close your eyes, breathe in and out. Wonderful practice. Let's do one thing. We'll do next practice, pranayama meditation for your cardiac diseases. You don't push yourself too much. I give you the concept, give you the asana practices, and I tell you you can do a lot more. Back bend, chest opening. Matsasana is a powerful asana. Looks like next weekend, Saturday, I'm out for another program. We see the week after where we are. Oh my God, I think that 2 or 3 weekends I'm going to be out of time. Anyway, next time we come for your Saturday morning practice, I'll get into the pranayama and meditation for the cardiac diseases. Thank you for participating. Take a look at it. This is extremely, extremely important for cardiac disease because we are all falling and dropping dead with a heart disease. Put your comments, put your questions in the Facebook. We're glad to answer. and I'll let you know when I come back next time. Thank you for joining. Thank you for listening. This will be uploaded to your YouTube and you will be able to follow it from there. Okay, thank you for joining. Bye-bye. See you next time.